Dr. Williams, I'm sure you get asked that a lot, but having a hair transplant, does it hurt?
It does hurt at times. The only time it actually hurts is giving the anesthetic. So there's two parts, the beginning and maybe halfway through. When you're at the start anesthetizing the donor area, you're giving an injectable lignocaine anesthetic, so that stings. But once that's done, you don't feel anything when the grafts are taken. And then later on, when you're about to make the incisions for the grafts, you would anesthetize the recipient area. And again, you're using an injectable anesthetic, and that stings. But apart from that, it doesn't hurt. And then after the procedure, surprisingly enough, you only need to take painkillers for about 2 days, 3 days. So it heals very quickly. The scalp has a very good blood supply, so that's part of the reason it heals very quickly, so you don't need to take a lot of pain relief afterwards.
Okay, but and on the day after the procedure or the night after the procedure, it is quite a long day. Do you need to take a lot of painkillers, or?
Well, during the day while the procedure is taking place, as I said, we use an injectable anesthetic, but we also start oral anesthesia as well. And then we continue with that after the end of the procedure, and then the patient takes these painkillers home with them. So occasionally they might wake up in the night feeling a little bit achy, but the majority of the time, surprisingly, you don't need a lot of pain relief, and you don't need to take them for that long, 2 days, 3 days.
Right. And any other thing that happened after a procedure, what else can you expect apart from a little bit of pain or discomfort?
Yeah, the commonest thing that we tell people to expect is you can get some swelling, a little bit of swelling of the forehead, and that tends to happen not the next day but the day after that, and that can persist for a couple of days. There are certain things you can do to reduce that, otherwise it can last for more than that, like 3 days, 4 days. So you can use a cold compress. We tend to give some steroid tablets for 2 or 3 days afterwards as well, and that tends to limit the time that lasts.
So basically just be a little bit careful and not do too much. And
yeah, you tend to avoid exercise. Avoid exercise for, say, 2 weeks. We ask them to sleep slightly upright for 2 or 3 days as well. You tend to avoid sunlight, avoid alcohol, avoid any painkillers that can make you bleed, like anti-inflammatories. So we tend to use paracetamol-based codeine, cocodamol, that sort of thing.
All right. Thank you very much, Dr.
Thank you.
Williams.